your chest, you can transect the aorta, the large blood vessel coming out of that heart. But when that happens, number one, that's not survivable usually, and you don't stand up after that kind of injury. Even if it was a mild dissection, these are very significant injuries. It's a very common injury. The third thing we're thinking about, it's called the R on T phenomenon. This is a phenomenon that when the heart is going between its beats, as that heart is depolarizing and then repolarizing, if you have traumatic trauma to the chest at a very specific moment, as that heart is repolarizing itself, you can go into a lethal ventricular arrhythmia. And that's what it looks like it happened, because he was able to stand up, and at that point, his heart started what we call fibrillating. That's that cardiac arrest. That's when he collapsed back down, and they would have recognized at that point no pulse. If it had been a cervical injury, you wouldn't expect him to have lost his pulse that soon. Same thing with a transection of the aorta. You may still have a pulse for a very brief moment. At this time, he had no pulse when he hit the ground. That's more of a ventricular arrhythmia that he was having. This is a dysrhythmia that happens after trauma. Now, the mainstay of treatment would have been, number one, protecting his airway, and then defibrillating the patient. We know that we have AEDs, or the automated defibrillators, all around our community. I am certain that they were in that facility. They were also on the ambulance, and we hope that he was defibrillated quickly, and that brings the heart back relatively quickly, because it shocks that dysrhythmia back into a normal heartbeat. They would have immediately intubated him and protected his airway, which they did, and if they're able to bring that heart back by defibrillating him, at this juncture, whether he survives or not, it will be dependent upon how long he was down and how long he was not getting oxygen. And now it sounds like he is in the ICU or in the medical facility, intubated at this time with a heartbeat. That's the information we're hearing right now. That means that he was most likely brought out of that lethal dysrhythmia, and now it's going to be dependent upon how long he was down and how much anoxia his brain would have sustained.
Well, the early reports mentioned that there were 9 minutes